Okay, we've been through some of this stuff. Okay, so this is basically people that are overweight, we know are going to have more of a chance to have sleep apnea. So let's take me, for example. I'm 6 feet tall. About 6 months ago, I weighed closer to 200 pounds. This is trying to get some sympathy weight off from my wife's pregnancy. So I was in the overweight category. Right now, I'm low 180s, and I'm right on the edge of being overweight. And I don't think most people would look at me and say that I'm overweight. So I think a lot of people are in this category here, kind of more the overweight/obese category. And again, the more overweight or obese, the greater chance for sleep apnea. These are things you want to look for in the dental office, okay? So things that you can look for to see if someone might be at higher risk for sleep apnea. So BMI greater than 30, neck circumference greater than 16 in a male. So my neck is a size 16. So someone with a bigger neck than me, or in a woman, a size 15-inch neck. High arched palate, so you look in there, you got these narrow arches, high arched palate, small jaw or retruded jaw. Mallampati, class 3 or 4, is usually more at risk or higher risk for sleep apnea. Obstructed airway you want to look for, of course. So looking back here, that's more normal. You can see a big airway there. Here is not. That's obstructed. Okay, you want to look for bruxism, especially anterior wear of the teeth. These are the people that Dr. McCarty was talking about earlier, where we think they're shoving their jaw forward all night long, trying to gain an airway. So they're grinding on their front teeth because that's where their brain has figured out they can get some air at nighttime. So if you see anterior wear of the teeth, especially in kids, you start noticing that. So if you have a kid that snores and a kid that grinds the teeth, that is sleep apnea until proven otherwise. That kid should go for a sleep test. Okay? And there's a lot of kids that grind the heck out of their teeth. Now, should we do a flat plane night guard for these people? That's what most dentists would do, because that's what we're taught in dental school. If you have a grinding tooth problem, then we put a piece of plastic in between there so you can't grind your teeth anymore. There's been a study that Levine published, Jill Levine, he's kind of the world's expert in sleep bruxism, and he showed that flat plane night guards in some people make their sleep apnea worse. Okay, so that's a problem, isn't it? So if our thought is anybody that grinds their teeth should be screened for sleep apnea and be forfeit with a night guard. Once the sleep apnea is ruled out and we find out, okay, it's just a grinding of the teeth problem, then they can be fit with a night guard. Tori, so these big bumps in here, we think that's due to tooth clenching or grinding. It's a buildup of bone, so that's something to look for. It's a maxillary torus, the mandibular tori here. GERD, so acid in the teeth. Again, that's a abdominal pressure thing, so putting pressure on the stomach, pushing the gastric fluids up into the mouth and eroding the teeth at nighttime. Big tongue, scalloping on the borders of the tongue. So this is a tongue trying to get out of the mouth all night long. So basically it's pushed up against the embrasures or the interproximal space of the teeth, and it puts these grooves in the tongue like that. Enlarged tonsils, those are big tonsils there. So you want to look for that. Oh, one thing to point out in kids. So a lot of people think in kids it's all about tonsil size. It actually there's no correlation there. So tonsils in kids, no matter how big they are, can still be sleep apnea. There's no correlation between size and severity of apnea. Okay, so we use a screening tool in our office. Every patient that comes in, we give this to a lot of our dental buddies too in our area. We say, give this to every single patient that comes in. Any of them that score high on this, send them to us for a free evaluation. And so that's a way that we market, is we give people free evaluations if they score high enough on this to come in. We then talk to them and say, hey, we think you might have sleep apnea. We think you should go for a test. So mainly with the stop bang questionnaire is what we use. It's 8 questions. If they score 3 or higher on this, there's a very high chance they have sleep apnea. So the 8 questions are, do you snore? Are you tired? Has anyone ever told you to stop breathing throughout the day? Are you being treated, or do you have high blood pressure? Do you have a body mass index greater than 28? Are you a male? Are you 50 years or older? Or is your neck bigger than, and that should be actually 16 inches. So those are all the different things that we're looking for. If you score 3 or higher, then high chance you have sleep apnea. Okay, so is anybody asleep right now? Getting close? Okay, not yet. So how sleepy are you? A video on sleeping. This is a nice video. You gotta watch kind of close though, it's kind of hard to see. So make sure you keep an eye on the car here, because this is anyway, we'll see. So that wakes some of you up there? Some of you knew what was coming up, huh? I did that a couple of months ago in a lecture, and one of the this lady sitting in the front row like that had some water, and she threw it all over herself. It's hilarious. So the end of that, it's a German commercial. It says, "You've never been so awake," and it's for like a coffee in a can type commercial. So we see a lot of this, right? We see, Starbucks is everywhere. It's on every corner. 5-Hour Energy, Rockstar, that happens to be my drug of choice. So we have all these different things to try to keep us awake. Well, why isn't there more treatments to help get us better sleep, So that's what we're trying to do. Trying to get better sleep instead of medicate ourselves to stay awake. So again, CPAP versus oral appliance therapy. It shouldn't really be CPAP versus oral appliance therapy. This needs to be a teamwork thing, medicine, dentistry.